So I think there's been a significant amount of progress being made around information sharing, and as part of the work we're looking to do with the NHS and leading organisations is to establish a set of exemplars around local health and care information sharing. That building upon, in effect, the expectation that many of us already have about care being joined up in any case, but making the most of the work that's going on at a local level, but really building upon that and making sure that that can interoperate in terms of all the various initiatives so that we don't end up creating more burden for patients or confusing professionals and creating burden for those folks as well. So what we're looking to do is to work with the service, with leading organisations, really focusing upon some of the non-technical side, because that's the really important bit around information sharing. So the public engagement, the professional engagement, the information governance, but then also around the co-creation of the standards that we need to put in place that allows information to then be used and accessed across the set of exemplars. And then that can give a whole set of opportunities, again within the right RG framework, around the wider app ecosystem, around the opportunities around supporting analytics, and around how do we improve the outcomes of my local population, but really focus upon the benefits that this enables and not necessarily just the technology. The important piece about public engagement is that it's not just a one-off thing. There's the upfront engagement around what we're doing, how's your data being used, what your preferences and so forth, but then the ongoing engagement with the public around what the benefits, what the new uses that are coming about. So fundamentally it's an ongoing dialogue with the patients and public, and what we're really keen to do is to pick off some of the really good learnings that have happened, but also to get insight from the likes of the National Data Guardian and other stakeholders around actually what does good look like, and then really being able to use the exemplars to demonstrate that in real life, and then also how that can be utilised, those sets of learnings can be utilised across the service through anyone who's involved in an information sharing initiative. And that's why, as part of what we're looking for in terms of areas and organisations that are coming forward, actually for me it's as much around the public and patient engagement, as much around the alignment of local transformation plans, of which digital is then embedded in. This is not about starting with the technology first and then trying to work out what to do with it. This is about what are we trying to do, what the benefits we're trying to achieve, what pathways are we trying to redesign and support patients in the local populations. And so patient engagement has to be the fundamental starting point for that. So what's been really evident is the number of local information sharing initiatives, so about 60 odd, that are already emerging and already in place, really demonstrates that actually at a local level this is seen as being really valuable. This is seen as being helpful, accessing test results from a GP into an acute, being able to see the clinical letters, the future appointments. Clearly there's a lot of momentum around the value of doing this, but what we have to then think about is, as we move to make these more robust and scalable, how do we ensure that what we don't end up doing is creating more burden for professionals by having to log on to a multiple set of shared records, a multiple set of systems? How do we ensure that we don't create more burden and confusion for patients around trying to access different shared records at different places? So part of the work that we want to ensure is that collaboration work between national and local organisations is to understand what those common standards are, what are those common components that need to be put in place, so that as patients move across organisations and boundaries, which they naturally will do, that actually that information can still be accessed within the appropriate controls. What we're looking for as part of the local health and care exemplars is a number of dimensions of maturity. Again, starting off with public and professional engagement, their strong and robust information governance approach, how this links to real transformation initiatives they have, be it around transforming cancer services, diabetes services and so forth, so that this again is embedded in local service improvement, as well as their maturity in terms of, from a technology perspective, the sorts of architectures they're looking to put in place. So we're purposely looking at a number of dimensions of maturity to be able to identify those leading sites, but also, as importantly, those sites that may not become exemplars. What we're really keen is, as part of the learnings and the sharings that we have from the initiative, that's actually a conversation between any information sharing initiative with the exemplars, because there's going to be sets of learnings that are out there that we're really keen to harness and pick on.